Veterinary radiologists are imaging specialists. They interpret complex medical images, including radiographs, CTs, MRIs, and ultrasounds, and perform diagnostic procedures that guide life-saving treatment decisions. A day in the life of a radiologist can go very differently depending on where they work. Let's explore how to become a radiologist, what veterinary radiologists do, the growing shortage of radiologists, where radiologists work from home to hospital, how different practice settings impact focus and productivity, and why protecting radiologist attention directly improves patient care. After earning a DVM, radiologists complete 4 to 5 more years of advanced training. This includes an internship, a diagnostic imaging residency, and a demanding board certification exam before becoming an ACVR board-certified radiologist. As of 2025, fewer than 1,000 board-certified veterinary radiologists are practicing in the United States. Radiologists often work behind the scenes, but their impact is central. Their expertise enables more and faster diagnoses, precise targeted treatment based on findings, and better outcomes for every patient. Radiologists play a central role in veterinary teamwork, translating imaging into actionable insights for primary vets, specialists, and surgeons alike. Their reports connect the dots in every patient's care journey. At SVI, radiologists are available to consult on complex cases, helping referring veterinarians understand subtle findings and determine the best next steps. Through clear communication and shared knowledge, radiologists unite the veterinary team around each patient. The results? Faster answers, aligned treatment, and better outcomes. Veterinary radiologists are in short supply, with fewer than 1,000 ACVR diplomates serving over 80,000 veterinary clinics in the U.S. Each minute of a radiologist's time has critical value to patients, referring veterinarians, and the broader profession. Radiologists work in a variety of environments. Home-based teleradiology offers interpretation of studies from any location. Specialty centers are advanced veterinary hospitals providing multiple specialties. Academic teaching hospitals focus on education and research. Mobile ultrasound services bring imaging services directly to general practices, and outpatient imaging centers are dedicated to providing diagnostic imaging procedures. Teleradiologists work remotely, reviewing studies from clinics across the country and the world. In a quiet, controlled environment, they avoid the constant interruptions typical of in-person practice. No walk-ins, no unexpected consults, no urgent procedure requests. This uninterrupted focus allows teleradiologists to interpret dozens or even hundreds of cases per day with speed and accuracy. As a result, many radiologists prefer this model, making it increasingly difficult for clinics to recruit and retain on-site radiologists. At specialty hospitals, radiologists are core team members. They interpret ultrasounds, radiographs, CTs, and MRIs. They perform image-guided procedures like fine needle aspirates, biopsies, and CSF taps. However, a major challenge in these settings are the frequent, unplanned interruptions. These disruptions may include a colleague with a quick consult or a vet tech needing help with an upset client. Although well-meaning, these interruptions pull focus away from diagnostics, slowing reports and delaying patient care. Constant interruptions are a big reason why so many radiologists look for work in telerad companies, making it difficult for clinics to recruit radiologists. In academic settings, radiologists divide their time between clinical work, where they interpret studies, instruction of residents in diagnostic imaging, and conducting research, contributing to innovation in veterinary medicine. Mobile radiologists bring diagnostic imaging capabilities directly to general practices. They scan patients on-site and frequently perform FNAs and fluid taps. However, while out of practice, radiologists often get off-topic questions about unrelated cases, disrupting their focus and schedule. Radiologists are becoming more rare in mobile settings because of the travel time, and clinic interruptions mean they can scan and read fewer than half the daily patients that a clinic-based radiologist could handle. Outpatient centers prioritize precision and efficiency. At Sage, our mission is to help as many patients as possible by keeping the radiologist's time focused on reading images. Radiologists occasionally perform advanced procedures, but their primary focus remains diagnostics. Thanks to strong team support, they can often work remotely. In fact, even when they are in their clinic office, they are effectively working remotely. Minimizing distractions and unnecessary interaction ensures timely, accurate, and actionable reports, which translates into helping as many patients as possible. A radiologist's core role is to interpret imaging studies and deliver reports. That's where their training and greatest value lies. Timely interpretation leads to faster treatment. When radiologists are asked to speak to clients, troubleshoot hardware, or monitor anesthesia, their attention is diverted from diagnostics, slowing diagnoses and creating delays in treatment for patients. Every role in an imaging center is designed to protect radiologist focus, maximizing the number of high-quality studies read per day. Client service reps handle scheduling and client communication. Veterinary technicians and technologists prepare the patients and operate the imaging modalities while ensuring great image quality. The imaging director manages and performs some procedures, manages anesthesia, and communicates with clients and vets. These team members allow radiologists to focus on interpreting studies with minimal distractions. A strong support team enables radiologists to work from anywhere because at their computer is where they have the biggest impact. Veterinary radiologists are highly trained specialists whose diagnostic expertise drives faster, more accurate treatment decisions. With fewer than 1,000 radiologists serving over 80,000 clinics nationwide, their time is precious. To make the greatest impact, radiologists must focus on what only they can do: interpret images, deliver reports, and guide care. Support structures must protect that focus. Help protect your radiologist's time by minimizing unnecessary interruptions. Ensure all information and patient data is prepared and readily accessible before requesting a radiologist's attention on your case, just like a teleradiology submission. Be respectful of the radiologist's time, and they will be respectful of yours, because more efficient reporting leads to faster and improved patient outcomes.